Annual hyperinflation. We've assumed that you've assessed your patient's suitability for the procedure and that there would be a likely benefit to them. You've done your hand hygiene and donned your clean gloves. So this is the circuit as it comes out of the bag. We have this white tip on the oxygen tubing that you don't need, so you can take that off and attach that end directly to your oxygen supply and turn it up to 15. So you can hear the oxygen coming through the bag. Now let's have a look at the valve. So Dara's going to block the valve, and you see if it's open, there's an option to release the pressure, but if it's closed, the pressure will build up in the system. Okay, so somewhere in between open and closed is the sweet spot for the patient, and this is why ideally you should have a manometer in the system to make sure your pressure doesn't exceed 40 centimeters of water. So when you're attaching the bag to the patient, you need to make sure that the valve is open, fully open. Okay, so that is fully open. So we'll attach it to our patient's ET tube. Now there may be another connector in real life. Okay, so your patient's spontaneously breathing, you don't need to panic. And you adjust the valve until you find a sweet spot where you're getting some filling of the bag. Yeah, so can you just do a few tidal breaths, so about 15, so about a quarter of the bag, about 500 centimeters. And you're watching the chest rise. If there's no chest rise, then all your oxygen is going out through the valve and your valve is too open, so you need to close it a little bit more. So do you want to adjust your valve there?
Okay.
Okay. Very good. So you're giving tidal breaths. Now in the research they found that for the deep breathing, physios usually deliver 1.4 litres, so that's about 3/4 of the bag. And the technique is usually to catch the end of the bag when it fills and twist. Obviously you would not. So you need to secure, catch the end of the bag and twist it towards, there you go. Very good. So you're delivering deep breaths. Off you go again. Now I'm going to secure the airway so it's not moving around too much, and this time I want you to deliver a deep breath and then release the valve really quickly to mimic a cough. So squeeze the bag, release the valve, release the bag. Okay, so you can see it's quite a motor skill, it's quite fiddly to learn, yeah? So squeeze the bag first and release the valve quickly. So I think it went straight out the valve that time.
Okay.
So you need to make sure you do the valve after emptying the bag, but just milliseconds. So squeeze the bag, release the valve quickly. Yeah. Okay?
Yeah.
So there's a lot of practice required to get this right. Okay, but so sort of a circular movement is better. So now I'm not doing this very well because I'm trying to film at the same time, but like a spiral movement.
Okay, so
there you go. Yeah. So you must always make sure that you're not putting any tension on the trachea. Our patient here is quite patient with us.
Very agreeable.
Yeah. Okay, so this needs a bit of practice before you get good at it. And you're watching your patient's cardiovascular signs on the monitor and their respiratory rate. You're watching their chest rise and fall, and you're listening for secretions. So you're decided, are you trying to recruit open up atelectasis? Are you trying to expel secretions? You're trying to work on compliance, so you know your goals before you start this. Okay, and you adjust your technique accordingly. Okay, so you need to be taught by someone who's good at it. But this just gives you an idea. Okay?